Welcome to the Nonprofit Report, your update on nonprofit organizations, issues, and leaders. I'm your host, Mark Oppenheimer. Today, we're chatting with leaders of the National Children's Advocacy Center in Huntsville, Alabama. I'd like to introduce you to Chris Newlin and Allie Tucker. Chris is the CEO. Allie Tucker is the board president. And thank you so much for sharing the work that you're doing. It's such important work. Chris, Allie, it's great to have you on.
Thanks. Glad to be here.
Yeah, thank you for having us and highlighting the NCAC.
So NCAC, the National Children's Advocacy Center, is seeking to transform the global response to children and children's needs and issues of abuse, neglect, all those really important issues that affect us all. Just give us a grounding of who you're trying to help. And then let's talk a little bit about who we're trying to engage in helping the people that whose lives you're trying to improve.
Thanks, Mark. So our mission is to champion and strengthen the global response to child abuse. And the reason we want to champion this issue, Mark, is because we do feel like it's a really important issue that has to do with protecting children's human rights and their personal safety. It's also, it is an important issue that has long-term impacts to our world's health and economy. So if we need to address the needs of these children, so we want to champion because it's a really important issue. We also want to strengthen because we want to, whatever we're doing, what someone is doing in a community X or Y, if they're at a 7, we want to help them get to an 8 or a 9. If they're at a 20, we want to get to a 21. We're always should be in constant effort to continuously improve our work to protect children. And then the global is exactly that. What the term is, all politics are local. So it starts in our local community. It's at the state level. It's at the national level. It's at the international level. So we want to be working at all those levels where we can to make positive change, to improve how our world responds to children and child abuse allegations. The issue that we're specifically focusing on, Mark, is historically, children were re-traumatized by a system that should have been taking care of them when there were allegations of child abuse, especially child sexual abuse. Instead of, when we think about child sexual abuse as an issue, it is a human rights issue. It's a criminal justice issue. It's a medical issue. It's a mental health issue. It's a child protection issue. No one agency or organization can address all those things by itself. So the only way we can be successful is by having a multidisciplinary team that works together, and whatever that team does, it should actually help kids and not cause them more harm. So the CAC model is founded on those two basic premise.
You're making a phenomenal point, and Allie, I'd like to sort of unpack a little bit about what Chris said, because behind what Chris's stance is this identification of adults being responsible. We are, by and large, the source of abuse. We are, as adults, we are the source of abuse of children. We could also be the solution to that abuse. And it starts off, Chris, with what you were saying. We all take responsibility for children, regardless of where they are in the world, regardless of their circumstance, regardless of their race. It's all of us. Allie, talk a little bit about how the board sees that prospect of being adults, serving on this board, and taking the kind of responsibility that Chris implies that we should all be taking.
Yeah, so I think, you put it very appropriately that us as adults, we are responsible for the health and well-being of all the children in our community. And, when you hear about children who have been through these traumatic circumstances and who have been abused, and you hear about how after they report it, the way the system treats them is worse than the actual abuse. That's a problem that needed to be fixed. And, 41 years ago when, Bud Kramer, started the task force that ultimately led to the creation of the National Children's Advocacy Center, they set out to solve that problem and to bring all of the adults who should be responsible for these kids, the police officers, the district attorney, the doctors, the social workers, all of them under one roof, to work together and respond to child abuse in a way that doesn't re-traumatize a child any more than we have to, and really try to take hold of those children and care for them in a way from, the worst moment of their life to turn it into something that, can turn into a positive experience, and, they can grow from, and it doesn't have to be any worse than it has to be. And I'm, in addition to being on the board, I've also been a foster parent for over 6 years, and I've had some of my kids have been interviewed at the NCAC and received services from the NCAC, and I've seen firsthand just how much of a positive impact they can have on children and their families when they're going through, one of the worst moments of their life. And it's really incredible, the work that they're doing there.
The thing that strikes me about the approach, the thinking that you're taking as an organization, is that it starts with the child's experience. It doesn't start with some theoretical policy that is made in some office conference room, right? As soon as you've determined that a child has experienced some form of trauma or abuse, it doesn't matter what the circumstance is. You're looking at it from the child's point of view. It doesn't matter if it comes out of the foster care system or it comes out of a child having experienced some sort of a traumatic event out of some sort of policy decision. You're responding to the child. Chris, could you talk a little bit about how that becomes politically complex when you have this very, very fraught discussion in our country about all these different matters, and you're basically saying, no, that might be somebody else's job. Our job is to think about the child and the child's experience and to alleviate that abuse where it actually is happening, that trauma where it's taking place, no matter what the cause.
Mark, thanks for the question. The partners that we work with, law enforcement, child protective services, prosecutors, those institutions are governmental institutions that have policies and procedures. They have histories of how they operate. They have longstanding reputations for how they work together. And they unfortunately sometimes don't always have children's best interests considered. If we think about even our criminal justice system in America, it was originally developed with adults in mind and then molded to try to kind of maybe meet the needs of child victims. But I think Bud Kramer said it really, really well back in the 1980s, that he said, if we're ever going to show that we really are taking this issue seriously, the protection of children seriously, and increasing public safety in our communities, we have to redesign how the criminal justice system and child protection systems work. No one agency can do this work alone. We have to work together. This is about not trying to protect our institution's integrity. It's about trying to protect the child's well-being. And we always, we have a phrase that we use sometimes, Mark, or oftentimes when we have a challenging case. And that is, we say, what would I want if this was my kid?
Well, what would I want if I was the child?
And so that's what our whole process is, looking at it because the old system was really designed about what does law enforcement need? What does child protective services need? What does the DA need? And instead, we need to be saying, yes, we need to be cognizant of what those institutions need, but we need to be most cognizant and prioritize the well-being and the protection and the best interests of the child, putting them in the best environment for them to be successful, to tell their story, and also receive the services in a setting that's going to be as supportive as possible. Children going to an institutionalized type of setting is never good. A place they've never been before, and having to do that over and over and over was just not effective for children. And as Allie said in the beginning, the system that should have been there to help children in one of their greatest times of need was actually layering additional levels of trauma on top of them by the way the system was designed without their best interests in mind. So we need to wrap our services around a child, not make a child fit into whatever we have created.
So could you both unpack the CAC model the Child Advocacy Center model and the multidisciplinary approach that is an attempt to get beyond the policy and procedures and political divisions that are undertaken by governmental organizations, right, and sort of transcend that and bring people together in a multidisciplinary discussion that ends up with better results for children. Chris, if you can start, and then Allie, if you could jump in with your practical experience, that would be fabulous.
So we have multiple standards that kind of define what it is that a CAC does. The first is having a child-friendly environment that's both physically and psychologically safe. Anybody who's ever had a child knows that if you take we're up on the precipice of the first day of school. How is the first day of school for some kids, right? It's intimidating. It's overwhelming. They don't know their way around. It's a foreign setting. They're around people they don't know. And so what happens is typically kids are, reticent. A lot of kids are reticent. They're scared to go. They're concerned about it. We need to be taking all of that into mind when we design where we want to have a child come when there's been allegations of abuse. Is it appropriate to take a child to a police station, a 6-year-old, an 8-year-old? I mean, that can feel very overwhelming, very intimidating. Same with a Child Protective Services office. How about go to your local emergency department? How child friendly is that? Like, it's chaos all over the place and waiting. There's not, limited opportunities for kids. Instead of those things happening, we now have children. The CAC model has children come to a child-friendly setting where there's not chaos, and there are very friendly people who offer a snack and offer them something to drink. And we have a waiting room that's specifically designed to meet their developmental needs. We don't make them wait long periods of time. We give them a tour of the facility, a brief tour of the facility, so they can understand kind of the context of where they're going to maybe be talking to someone in the future, where their caregiver is going to be, all this done in a very child-friendly manner.
And you're making a very important point, right? It has to be decentralized because kids grow up in different environments and different cultures, right? If you have somebody coming in from an inner city environment and they might be their cultural context is, I don't know, with Asian families, or another kid that grows up in a rural environment, or whatever the linguistic or cultural reference points. If you try to create this as a government program where you have generic standards, you could be bringing a kid inadvertently into a completely foreign and re-traumatizing environment where their anxieties are raised. So you do have to have this be very decentralized, don't you?
Yeah, and we need to have staff that represent the diversity of our community. In fact, the first thing a child and a family will see when they come into the NCAC is a mosaic sign that says, "Here, you're free to be exactly who you are." We need to communicate that. So we have multilingual staff. We have people who look different on our staff, so that when children and families arrive, they can feel comfortable. We have a facility dog if the child is comfortable being around a facility dog who can be there to help reduce their anxiety. All of these things are very intentional, looking at it from what is it that children need. And a lot of our best ideas actually come from kids who have come through our systems, ideas they share, feedback they provide. And so the first step is just having this child-friendly environment. We don't have big, loud, aggressive colors. It's more muted. It's intended to be relaxing. Everything was done incredibly intentional to create a child-friendly space that will make sure that they're supported, but also foster collaboration. That's why we have our multidisciplinary team co-located on campus with us. So in a building right next to where we see kids is where we have all of our police officers, all of our prosecutors, that when they come to work, this is where the Special Victims Unit is located. It's not at the police station, it's here, so that we can work together on a regular basis. If we have an emergency, they can come over right away. And it's about having that relationship and proximity that, yes, we work for different organizations, but we're all co-located together. And interestingly, Mark, if you know anything about the history of Huntsville, Alabama, that's actually what led to one of man's greatest achievements. It was the idea that how can we possibly get man to the moon? And that required us to have different professionals with different backgrounds, different expertise who were working together for one goal that's bigger than anything that they could accomplish on their own. But coming together as a team, they were able to take man to the moon and land man on the moon. And that history is embedded in the rocket scientists who came from Germany and helped develop a lot of the space industry in Huntsville. We took that same ethos, that same idea, and applied it. How do we protect children? It requires this team working together. And our job is, and we say it all the time here, if everybody on the team is helping everybody else be successful, we're actually going to help kids and improve their outcomes and make our community a safer place. So one is we have to have a child-friendly environment. Two, we have to conduct forensic interviews. In child sexual abuse cases, especially, typically when that happens, there's only two people in the world who know what happened. There's the adult who did it, or the person who did it, because sometimes it's people under the age of 18. And then there's the child who it was done to. Most child sexual abuse happens in private. So the only way we can find out what happened is by doing a really good, developmentally appropriate, legally defensible interview with the child. And that's what the first step that a child experiences when they come here.
And there's some really interesting statistics, Allie. There 186,000 child abuse prevention professionals have been trained locally and internationally. Over 10,000 children were impacted by local programs. I mean, that's an incredible an incredible track record. How does the board function as a governance entity? Because part of your objective as a board is to ensure that Chris and his organization stays on track in terms of expanding that footprint. How do you look at how Chris and his team report on impact on a regular basis to ensure that progress is being made year over year?
I like to think of the NCAC as it's a local organization with a global impact. You know, what started here in Huntsville didn't stay here. And so now the NCAC trains these professionals all over the globe, and there's hundreds of children's advocacy centers all over the world. And it's just an incredible testament to the impact that they're having all over, and just being at the forefront of that industry and training everybody, professionals all over to, help them set up their own CACs in their own communities. To your point earlier about, this not being centralized and, having your own CAC in your own community, I think is really important for each community to have that so that they can address the children in their community in a local way.
And what you're saying is there's a templating process, right? That things are created and tested in Huntsville, and then that is deployed as a model internationally.
With some adaptations, because, there's different, like we've been doing some consulting with the Dubai police. They want to develop a children's advocacy center, but, I'm not an expert in Sharia law. One of the considerations is we would have to have separate prayer rooms for males and females. Like that's not a consideration that any CAC in the U.S. So I think you can take some of the macro lessons that we've learned about having a multidisciplinary team, having well-trained professionals, having high degrees of collaboration. All of those things translate regardless of society, but some of the specific implementation requires really important social, political, cultural understandings and adaptations to make sure that those individuals are receiving those services. We see it here in the United States with some of our tribal communities and Alaskan Native communities, but it also can happen internationally. And that's just a testament to one of the basic tenets of we have to meet children where they are, regardless of language, other customs. We need to be available for them and to meet them where they are, which overarches everything that we do, whether it's forensic interviews, medical exams, evidence-based treatment. All of those pieces need to be done with that lens.
And I think what you're also pointing to is this sort of humble understanding of difference and respect. We have, as a country, sometimes stumbled into disrespectful conduct out of a lack of understanding of different cultures, whether they're native cultures and native practices or cultures across the world. And what you're saying is okay, within a Sharia law context, you have to stop and learn first. You have to stop and listen first. Then you have to collaborate with people who have a different cultural reference point. Doesn't mean that you're giving up your cultural reference point. You're trying to figure out what is best for children within that environment. And that's really important, this whole idea of stopping and respecting and understanding, and then ceding control, but having standards. How do you navigate that whole idea of ceding control, yet still having standards, Chris?
It's the necessary complexity of the world that we live in. If it was easy, it would have been done long ago. We had to break down a lot of artificial barriers that were there. For many, many years, law enforcement and child protective services not only did not work together, but they had very different worldviews and actually viewed the others, each other as being problematic
They worked
and not part of the
purposes.
solution.
I can't tell you how often I've been dealing with both sides of that and listening to that sort of feedback and frustration with the other. How do you get people in the room and just sort of hold forth and get people to talk about their authentic experiences?
Well, and I think that's one of the things that between myself and also the board, we have stakeholders that serve on our board, and those are the senior leaders from our partner organizations. And they need to have voice and audience into the opportunity to provide feedback, share their perspectives. But part of my daily work, Mark, is to engage these senior leaders at different levels of leaders to say that we're trying to do something together that none of us can do alone. There is no government mandate that says they have to collaborate with us, but it's about continuing to elevate that we're going to help you do your work. We're going to help you be more successful. And if you go ask any of our detectives, like if they said if the NCAC was gone tomorrow, what would happen? And they would be like, we couldn't do our jobs. We couldn't function. We'd be going back decades of how we used to operate. So this entire enterprise, Mark, is about it's social entrepreneurship. Really, it is about, we're not here to make money, like some entrepreneurs. We're here to make a big difference in the lives of youth. And the stakes are huge because the long-term cost of, trauma in children's lives as they become adults, as they enter the workforce, as they are entering our healthcare systems, as they're entering whatever institutions they're in, it has a huge negative impact if we don't intervene successfully. So see, even if someone doesn't care about kids, the business, case is overwhelmingly in favor of supporting this.
Allie, since a board is there to provide oversight, but also to engender support, donor support, partner support, and so on, have you seen any kind of resistance from donors in terms of this ecumenical, very embracing, very focused on respect for difference that Chris is describing at the board level? How do donors feel, for example, about making donations where their funds are going to be used by communities that are far away geographically and otherwise? How are you all responding to this idea of giving to others the expertise and the resources that you've accumulated that could be deployed solely in the neighborhoods of Huntsville, Alabama?
Well, I mean, the NCAC does have a huge impact in the Huntsville, Alabama, and Madison County area, and provide services to our kids here locally. So, we don't really get a lot of pushback, from donors on that front. I think as a community, we're very proud that the NCAC has had this impact on a global scale, and we want to be able to, who doesn't want to help kids? I think the biggest struggle in telling the NCAC story is you're talking about, child abuse, and it's not an easy thing to talk about. And sometimes people don't, are uncomfortable talking about it. And so sometimes it's hard to tell that story and tell those success stories. Also you're dealing with confidentiality and that sort of thing as well. So I think that's probably the biggest challenge in telling the story of the NCAC. But I do think that Chris and his team and the people who have come before me have done a great job of, advocating for the NCAC in our community. And we do have a lot of local support here and people who really believe in the mission of the NCAC. And I think Huntsville as a community is a very entrepreneurial community who wants to do the right thing and wants to, you see a problem and you want to fix it, right? And that's what the NCAC did. And so we want to continue to support that and support that across the globe.
Yeah, there's more than 1,000 CACs across the United States, served over 365,000 kids last year. So in community X, community Y, all across this nation, there are boards there that are raising money in those communities and supporting their efforts. Quite honestly, the money that we raise, it stays in our community, provide our local services. What we are very passionate about sharing is the concept about the model and our training and expertise so that these other communities, it's about teaching more people how to fish as opposed to just giving them fish.
Well, you're also sharing the inventions of Huntsville, Alabama with the world, right? When you invent it, it's true it's a very human impulse. If you invent it and you're proud of it, share it, right? Have other people take advantage of that expertise and then go out and learn from them. I bet, Chris, that there's feedback that you've received from markets far away from Huntsville that has then informed your work in Huntsville, and then you've exported that again. Do you have any stories that are interesting?
Well, there's a phrase that we use in our area of work, which is to share relentlessly and to steal shamelessly. So, and that is kind of the ethos of the Children's Advocacy Center and internationally Barnahus model, that it is all built on, new people coming up with new ideas, stretching what we do, expanding the concept of what might be possible. And when people come up with some of those ideas, then we see an expansion. I was just meeting with a funder today talking about this innovative project that we're doing between contact child sexual abuse and online child sexual abuse and production of child sexual abuse material, and how we're trying to do something innovative to bridge the gap. It's always about testing out these new ideas. And if that has viability, like we think it might, the possibility for scalability is dramatic, and the number of children that could be impacted. So that's what fuels our drive every single day, is to continue to try to build a better mousetrap and make sure that the kids in our community are getting the highest quality services that we can provide, and that we're then helping disseminate that through all of our various training and technical assistance to others, but also highlighting the great work of other children's advocacy centers in Barnahus. And when they have a great idea, that should be celebrated and brought to the table. I know it's trite, but, a rising tide raises all boats. Our kids, every one of our kids, regardless of the language they speak, the color of their skin, what they believe or don't believe, they deserve a good boat to live in.
It's a fabulous message. We're going to wind up because we're coming to the end of our time, but I'd like you both to comment on the one thing that you'd like us all to remember at the end of this discussion, either a program that you're advancing right now or some value that you'd like to promulgate. Allie, could you start us off, and then Chris, if you could wind us up?
I mean, I think at the end of the day, just highlighting the work that Chris and his team are doing, and all of people at CACs across the globe. I think what they do day in and day out is an incredibly difficult job. And they deserve a lot of, praise and respect for that. I think, anything we can do to help support children and families that are going through these difficult times, I think is important. And supporting organizations like the NCAC is key to that as a community, so that we can, I think one of the questions on your outline was, what's the end goal of this? And I think if the NCAC was no longer needed because there was no longer any more child abuse, that would obviously be what we would all love to see, right? And so just keep working towards that to reduce the amount of pain that our children have to go through and increase their success stories, I think would.
So your thought is to be so good at our job so that you're no longer necessary, right?
Yeah.
I mean, I don't think it'll happen in our lifetime, but yeah, that would be incredible. Like if we were no longer needed, That would be incredible. I think, I mean, I'm going to build off of what Allie said, and that is, yes, we see a lot of kids that are in a lot of pain. But unfortunately, our society has told ourselves some stories that are not fair to these children or the adults that these children become. And that is the story that child sexual abuse somehow is a life sentence, that someone's life is ruined forever, that they'll never be okay, that they're never going to get better. We actually have models that really help. And so we need to instill a little bit more hope in our world that it's terrible when these things happen. We wish they did not happen, and we wish we could prevent them. But when they do, we have models that can help. And this is a model that truly has been demonstrated to be overwhelmingly positively impactful and successful. And the second thing I would want for people to take away from this is that the kids that we see, they become adults. They become your daughters-in-law. They become your son-in-law. They become your employees. They become your neighbors. And that we should all have a bit more grace and acceptance and understanding that a significant amount of our adult population experience this as children. And I can't tell you how many times, Mark, we have parents who used to come in and say, I wish there had been a program like this when I was a kid, because they experienced abuse. Now what we hear, Mark, is we have people who come and say, yes, I know what you do. I came here when I was a child. And here's a powerful takeaway. I was presenting in front of a leadership group a few months ago, and we did a panel presentation with our multidisciplinary team. We talked about the work that we do. We actually had all of our partners there represented to talk about how we collaborate. And people had great questions. People were really like, oh, I really had no idea. This is just something you don't really have insight into. And after it was over, a middle-aged woman approached me. And she said, I really appreciated all the presentation today. She said, do you ever have former clients speak on your behalf? And I was like, well, we've done that occasionally, but there's all issues of privacy and confidentiality. We want to help protect that, someone. Long story short, she said, well, if I can ever be a help, I was a client of yours in 1986.
That's fabulous.
This woman now has her PhD. She works at a defense contracting firm. And so she came actually over and we did a whole tour of the campus. We spent some time talking. And what she said is, Mark, she said, Chris, not a day goes by that I don't think about the NCAC. The impact that you all had on my life when I was that little girl who was struggling with what had happened to me, and the support that I was shown, and how I felt like I was important and my thoughts were and perspectives were important. She said that has stuck with me for all these years later. The impact that you all have had on me, I would not be the person I am today had it not been for the work that NCAC did for me and my family when I was that little girl. And she said, I just want you to know that there are so many other little boys and little girls that are now adults like me who are positively impacted. And she said to even think that there's all these CACs that are doing this in communities all over the country is absolutely phenomenal.
So what I hear from this story and from this discussion is that as adults, we're not the point. Process rigidity is not the point. Our jobs are not the point. Policy isn't the point. Cruelty is not the point. The point is children, compassion, healing. That's the point.
And collaboration.
And collaboration. We have to get over ourselves. We have to listen to each other. We have to come together. Chris Newlin, Allie Tucker of the National Children's Advocacy Center, thank you so much for your work. Please thank your staff, your board members, your supporters, your donors, your communities, and the children who are part of that circle of benefit, who grow up and help other children as they help you. It has just been so wonderful to hear about your work. Thank you for sharing.
Thank you, Mark, for highlighting the NCAC and having us.
Thank you, Mark. We appreciate the opportunity to share our story.